Unang kaso ng FE.1 Omicron sa variant sa Pilipinas. Ang ating pong pag-usapan ngayon with Dr. Rontgene Solante, infectious diseases expert at ang Pangulo ng Philippine College of Physicians. Dr. Solante, magandang araw.
Hi, good morning, Aljo.
Opo, Doc, para sa kalaman ng ating mga kababayan, ano naman po ang mga characteristics at sintomas, bago naman po ito, FE.1 Omicron sa variant na na-detect sa Pilipinas?
The subvariant of the Omicron, no? So, kumbaga, it is under the umbrella of the XBB variants of interest. Kasama dito, kumbaga, magkapatid lang to sa XBB.1, .16, XBB.1.5, which are the two dominant subvariants now of Omicron, and which is also present here in the Philippines, no? And so far, in terms of the characteristic niya, Aljo, no, there are no direct evidence yet na itong bagong subvariant na to ay mas mataas na makakahawa or pwedeng makakos ng severe infection or pwedeng makakos ng, or pwede siyang malusutan, no? Yung malusutan niya yung immune system natin even if we are vaccinated, no? But there are specific mutations, no? They call it mutations of interest na magkahawig talaga sa XBB. At alam naman natin ang XBB, ito yung mga variants ngayon kung saan tumataas ang mga kaso the past few weeks or the past months, and minsan meron ding na hospital, no? So it may not be different, totally different as those XBB. So most likely it can still cause severe infection, but only for those who are highly vulnerable, like the elderly population. And most of the symptoms are mild because ang kadalasang tinitirahan nitong mga bagong variants under the Omicron is in the upper respiratory tract, no? Not lower respiratory tract, unlike yung Delta. So we would expect the same clinical manifestation as that of the Omicron: ubo, lagnat, sore throat, pananakit sa katawan. And mostly these are very mild, and most of the time, especially pag mga younger population, hindi kailangan gamutin at hindi magpo-proceed doon sa severe form of infection.
Okay. Dapat ba tayong mangamba dito sa subvariant na ito, Doktor?
Well, just like any subvariants in the past na na-report dito sa Philippine Genome Center, kailangan talaga nating ma-monitor, no? Now, kung in terms of pangamba, we should not panic because for almost 2 years now, maganda ang healthcare utilization rate natin. Hindi naman nakakakos ng most severe infection. Pero ang pangamba ko lang dito, Aljo, are the vulnerable population, especially na alam natin ang immunity ng mga vulnerable population talagang bumababa 4 to 6 months after the vaccination or even after the exposure of a COVID infection, no? So ito yung mga population na kailangan nating palalahanan palagi na magsuot ng face mask at i-update ang kanilang bakuna para lang naman an added layer of protection para hindi magiging severe sa pagkakuha or kung makakuha ng ganitong FE.1.
Okay. Ito bang mga bivalent vaccines natin, epektibo ba laban dito sa bagong subvariant na ito, FE.1?
Wala pong data na nakita tayo so far na sa mga bivalent vaccine na tinitest dito sa bagong FE.1, no? But if I'm going to correlate the efficacy, no, yung bisa nitong mga XBB or itong bivalent vaccine dito sa mga XBB, there is substantial protection naman, no? Hindi naman talagang zero, no? But again, hindi ganun din kataas. And that's why it's important na kung halimbawa darating man itong mga bivalent vaccine for the booster of the healthcare, including the senior citizens, sana mapabakunahan kaagad natin para at least meron pa rin protection, hindi makakuha ng itong mga bagong variants na under the Omicron lineage. And at the same time, napaka-importante pa rin ang bakuna in order to maintain the population immunity para hindi tatagal ang paghawaan at yung pag-develop ng mga bagong mutations with Omicron.
Okay. How about ang positivity rate ng Pilipinas, Doktor, sa ngayon? Lalo na dito sa NCR, tumaas ba?
Well, ang maganda ngayon, Aljo, no, for the past week, based doon sa mga surveillance na nakikita natin sa Department of Health, no, mababa na pa ang trending is going down, especially with the National Capital Region. Ang positivity rate for the past 7 days bumaba to 7.2%, no, which is one of the lowest so far this year, no, even with this mga bagong XBB. And at the same time, what makes this good is that sa tingin ko stable na yung mga COVID infections natin dahil even the healthcare utilization rate bumaba na rin to less than 25%, and yung ICU occupancy is also less than 20%. No? So meaning these are so manageable rate of healthcare utilization and ICU, and most of those na natatamaan dito are really the vulnerable population. So in a way, medyo nalampasan na natin yung effect ng mga bagong XBB variants of interest. Ang gusto lang natin na mapanatili natin yung immunity natin at saka protection by always observing the health protocol at pag-receive ng mga bagong bakuna.
Okay. Sa ibang usapin, Doktor, papaano po makakaiwas sa mga sakit ang ating mga kababayan na sa mga evacuation centers ngayon na apektado po ng pag-alboroto ng bulkang ngayon? Ano-ano mga sakit na dapat nating bantayan sa mga evacuation center?
Okay, napaka-importante, no, sa mga evacuation center kasi pag nasa evacuation center, hindi natin ma-prevent yung crowding, no? And most of the time, importante dyan, no, para maiwasan ang mga sakit, it's important that we need to observe also the health protocol, no? Kailangan titingnan yan ng mga local government unit. Provide clean and potable water kasi may mga sakit na pwede nating makuha dito sa contaminated water kagaya ng mga diarrheal diseases like cholera and even typhoid, no? Even amoebiasis can also be can be caused by water. And at the same time, yung respiratory tract infection, that is one of the most common infections dyan sa mga setup na yan, no? Dahil walang protection at sama-sama kayo sa isang lugar. And in fact, data are telling us na mataas ang rate ng cough, no? Colds, even pneumonia, even tuberculosis can also be acquired in evacuation centers, no? And then yung pangatlo naman, yung skin infection, dahil may mga skin infections na talaga highly transmissible also during the time, mga fungal infections. So, napaka-importante na panatiliin ng local government unit ang hygiene, malinis ng lugar, susuot ng face mask, tapos yung mga matatanda, they have to be protected, no? Kasi ito yung mga vulnerable, including yung mga bata, which is really vulnerable sa mga diarrheal diseases and doubly ingat in this type of situation.
May tanong po si Mark Fetalco ng PTV News. Sinabi ni Health Secretary Ted Herbosa na magbibigay ang Health Department ng temporary license sa mga nurse na may nursing licensure exam grade na 70 to 74%. Para punan po ang nasa mahigit 4,000 plantilla positions. Ano po masasabi niyo tungkol dito, Doktor?
Well, I think it's a good alternative plan, no? Kumbaga, ano to siya? Plano para lang madagdagan ang nursing personnel sa mga hospital na ngayon napakataas ng napakalaking problema sa mga hospital kaya hindi fully functional, no? Now, unang-una, ang importante dito, these are all board eligible, no? So meaning they are already competent enough to do nursing work because graduate na sila sa nurse. It's just a matter that when they will be incorporated or isama na natin sila doon sa mga hospital, they have to undergo training also, no? Na yung mag-train ito, they will look at how they are competent enough to be working in the hospital. Pangalawa, once they will be immersed also in the hospital, they should always be monitored by the regular nursing staff in the hospital. No? So to monitor them at the same time, ano yung mga ginagawa, tuturuan sila kung anong tama. Because for me, even if they are not taken the board yet, they already possess the skills of a nurse. It's just a matter that they still have to take the board. And pangatlo, napaka-importante nitong hakbang dahil we can encourage those na nagna-nursing pero hindi pa nag-take ng board, tawag nito, pumupunta ng ibang work, no, kagaya ng mga call centers, no, because we need more nurses. Ang dami natin mga graduates na nurses pero konti lang yung nagte-take ng board. Then this is something na another layer of work na gusto nating i-encourage sila to be a nurse and to serve the country. At later on, pwede naman silang lumabas when they will be ready also to be board eligible or to take the board.
Opo. Mensahe na lang po sa ating mga kababayan, Doktor.
Okay, so with this state of the COVID natin, no, we're more stable. Meron tayong bagong variant. We should not panic. The bivalent vaccine will be available in the next few weeks for the healthcare workers and the vulnerable population. Panatilihin natin ang population immunity by also getting this vaccine. And of course, ingat pa rin, no? Follow the health protocol at this point in time. Salamat, Aljo, sa pagkakataon na ito.
Opo. Maraming salamat po sa inyong oras, Dr. Rontgene Solante, infectious diseases expert at ang Pangulo ng Philippine College of Physicians.